Good morning and welcome to Senior Break. This morning, my special guest is going to be Belinda Aiello with Healthcare and Medicare Choices. But before we start with you, I just want to say Dawn couldn't be with us today, but she will be back on our next show. So just wanted to let you know where she is. Okay, Belinda, welcome and thank you for being here. And,
thank you, Marie.
Medicare Choices, it's a big deal for seniors because we're so confused. We don't know what to do. We don't know if we should change, if we should keep what we have. A lot of us are just afraid to change anything.
Right.
You know, we don't know what to do because it's going good, but yet we feel like we need something. So we're hoping that you can answer a lot of questions today.
Okay.
Belinda is with Healthcare and Medical Choices, and you're going to let us know where you're located.
Yes, Marie, we're located at 880 West Dryden Road in Metamora, and we have an office there to meet with people privately. We will also meet with people here at the Oxford Township Senior Center. We can meet with people at the Addison Township Senior Center. We also make home calls. If you're a senior who's homebound, we will make home calls to go over all the information with them.
So would they just have their papers ready, what they have, and then you would just go over that with them and then tell them what would be better for them or keep what they have? Or?
Right, we will just review their existing Medicare plan or prescription drug plan and see if there's a better plan for them based on their health and their finances.
Okay, I've noticed on the cards there's different little letters, like, is that right? That would say A, B, or N. Or what do those letters stand for? Am I talking about the right card?
Well, the Medicare card has the A and the B on it.
Okay.
Okay, that's original Medicare.
Okay.
And then some Medicare supplements have other letters like N or G or F. Those are just specific plans.
Okay. So what does the A and B mean on the Medicare card?
The A and B is original Medicare, which you get when you first turn 65.
Okay.
And the A covers you for your hospital, for your skilled nursing, for hospice, and for blood.
Okay.
The Part B is pretty much everything else except for prescription drugs that you pick up at the pharmacy.
Okay.
So things like labs, doctor's appointments, diagnostic testing, medical equipment, therapy, things like that.
Okay. And up until I met you the last time, I did not realize that there was an advocate out there for us. So it's really good to know. So if you do need somebody, you really do need to contact Belinda, or if you're not in this area, she can tell you, right, who they can contact in there. That's really important.
We have 6 agents with our group. Mm-hmm. And so we go all over Oakland County, Genesee County, Livingston, Shiawassee, Lapeer. We're local agents working for you.
And do you have to be 65, is it?
You don't. Some people on Medicare are not 65. They receive Medicare because they may be on disability under 65. They may have end-stage renal disease. They may have Lou Gehrig's disease. Those are the people that can also qualify for Medicare.
Okay, that's good. And I'm going to go to the original question, is tell us, what is Medicare?
Okay, Medicare is a federal government program that people, again, like I said, when you're nearing 65, you can get on your Medicare. If you decide you want to continue to work and you have credible group coverage, you don't have to take Medicare. So if you're going to continue to work, you just need to make sure that you have credible coverage, and then you can apply for your Medicare later.
Okay.
However, if you're 65 and you don't have coverage under another program, like a group program, an employer, an individual coverage, you're open to the late enrollment penalty. So you need to make sure you have health care of some type before, so you don't incur a late enrollment penalty.
What are the dates for the enrollment?
Every year, there's annual enrollment for Medicare, which is October 15th through December 7th. And that is the time to review the plan you have. You can sit down with a local agent who will look up your doctors and your prescription drugs and find out if that plan is still a good plan for you, because things change over years. Seniors, like you said, don't want change, so many times people stay in a plan that is not serving their needs too long. So it's always good to review and see what your options are.
And that's coming up, you said October 7th.
October 15th.
The 15th, okay.
Through December 7th.
Okay, well, that's coming up next week.
Yes, it is.
Right, okay. Well, let me see what else I have here. What services does Health Plan and Medicare Choices provide?
We provide sitting down, of course, with an individual, and we sell the Medicare supplements, the Medicare Advantage plans, the prescription drug plans. Also, we help people under 65 on and off the marketplace with health care and short-term care for people who might have a gap and need short-term coverage.
So do they get the same book? I know I get a book in the mail that tells everything, and that's the book that we can use as our reference book.
Right, the Medicare and You book, that's basically your Medicare Bible.
Okay.
But if you don't have time to sit down and read it from cover to cover, we have all the agents are educated every year with an annual Medicare certification. And we take training with all the carriers we are with so that we know the products.
Okay, so can you tell me a little bit about the prescription? Because it's kind of together, but it's kind of separate, right? Because it's, yeah, you could explain it.
Right, you can, when you get on Medicare, you can opt for a Medicare Advantage plan. And that takes your Medicare Part A, Part B, and adds Part D for prescription drugs in one plan.
Does that change A or B at all?
No.
When you
No, but it puts it all into one plan that administers your health care and prescription drug coverage. Or if you're a person that has a Medicare supplement, you have to buy a separate standalone prescription drug plan. And those are plans that we will review with people. It's good to get with someone who can look up your drugs and find out what the best plan is for you, because, especially if your drugs have changed.
So would that mean that if you have A, B, and D on your Medicare card, that your drug company would come right on that Medicare card? It wouldn't be a separate company, or is it always a separate company for?
If you're on a Medicare supplement,
yes,
it's a separate company. It's a separate card. So if you're on a Medicare supplement, you have to present your original Medicare card and then your supplemental card. And if you go to the pharmacy, your prescription drug card.
And it depends by what you have to take, like you're saying.
Right, and if you're on Medicare Advantage, it's generally one card for everything, for all medical, hospital, and prescription drugs.
So much to learn, so much to know. So glad to have you here. We're going to take a short break, and we'll be back to ask Belinda more questions.
Canine Stray Rescue is Oxford's own local dog rescue. Each year they take in hundreds of dogs and bring them into suitable homes. A certified nonprofit organization, Canine Dog Rescue strives to give pound dogs a new leash on life. To donate, adopt, or even volunteer, call them at 248-628-0435 or go to their website, dogsaver.org, and click on the Canine Stray Rescue League link.
Welcome back to our show, and we have Belinda here with Medicare Services, and we talked a little bit about the Medicare things that they provide. And I'm still a little confused, so Belinda's going to explain why we have 2 or 3 different cards and what these different cards mean. Now, I know we have the one Medicare card that says A and B.
Yes.
And I'll give it to you from there.
Okay, so anybody who is on Medicare has to have A and B to be able to get a Medicare plan.
Okay.
So there's 2 choices to add to your Medicare card.
Why would I want to get another card? Why would I want to get another supplemental? Why would I
Okay.
want to?
If you go with just the Medicare original card,
Okay.
it only covers you at 80%.
Okay. Of most everything?
Yes.
Okay.
However, that 20% has no stop line, no protective umbrella. It just can keep going.
Okay.
So if you had a hospitalization and skilled nursing, lots of bills, 20%
Could
can
add up to a lot.
to a lot of money.
Okay.
So you can either elect to get a Medicare supplement, which will
Okay.
cover the other 20%.
Which is another card with another company.
card with a
Okay.
with a separate health insurance carrier,
Okay.
and then you want to pick up your prescription drug card separately as well.
Okay, so I'm just going to make sure I have this right. The one Blue Cross card that's, the one Medicare card that has A and B in it covers 80%.
Yes.
So then I get another one from another insurance, and they're going to cover the other 20%.
After
That
a very
Medicare-
small deductible.
Okay.
You have a very small deductible.
After the whatever Medicare didn't cover. So now I'm left with my prescriptions.
Right.
So now I'm going to get another company, which is my third card.
Yes.
Okay, now tell us about that one.
Right. And that the third card is your prescription drug card
Okay,
that you will use at the pharmacy.
okay.
Okay?
And how do I know which one to get? How do you determine to tell me which would be the best company to get for my prescriptions?
Well,
do you
typically,
review my prescriptions?
yes, typically we would have a person come in once a year, review prescriptions, see if the prescriptions have changed. A lot of times the formularies that the companies have change year by year. So
Okay.
it's very good to review your prescription drugs once a year. Make sure you're still in a good plan. And if you're not, find out what your other options are.
Well, the reason I like this so much is because I feel like somebody's on my side. Somebody's looking at what I need and
Yes.
telling me what's best, not me just thumbing through a bunch of papers and trying to figure what do I need. Or I can remember looking at different columns and thinking which one is best for me, and I didn't even understand half of them in
Right.
the first place. So it's really good to know that there's somebody out there that you can call, and you're saying once a year review. That's really good.
Definitely
Because
once a year.
everything changes. Everything
Right.
changes. So if you have a lot of prescriptions to take, you might want one plan, right? If you only need a couple
Right.
prescriptions, you might need another plan.
It's just based on your prescriptions and
Mm-hmm.
where they fall in the tiers and levels.
Okay, this is good. I hope people are realizing that we have help
Right.
for Medicare. Okay, we're going to go over a couple things. You specialize in Medicare supplements, which you kind of we're just talking about. What's the Medicaid Advantage?
The Medicare Advantage plan.
Medicare, I'm sorry.
Yep, the Medicare Advantage plan is the one that takes your Medicare Part A, Medicare Part B, and adds Part D drugs all into one card.
Oh, okay.
Those are typically HMOs or PPOs, and you would sit down with an agent and discuss the differences and figure out what is best for you based on your lifestyle. If you're a person that stays in state, are you a person who travels a lot? Those are all things to consider.
Okay.
You've heard on television about the Medicare Advantage plans. Many provide extra benefits such as dental, vision, hearing, gym memberships like silver sneakers, and over-the-counter products that you can either order out of a catalog or you can take a debit card and go to your local store and pick out things over the counter that you use every day.
So when we see the commercials on TV, are those accurate?
Well, it's hard to say. I mean, obviously they're on television because they would like you to call their number.
Okay.
I feel that it's more important to sit down with somebody real and local who knows your local doctors, can look up your prescriptions. I feel that over the phone probably is not a thorough way to review your Medicare.
Okay,
in my
because they
opinion.
can't actually see your papers or see what you really want, what you have and what you need
Right.
compared to what you need. And what about phone calls? Because, we get so many phone calls about insurance.
Medicare insurance agents are not supposed to call you unless you've filled out a form stating, yes, I want you to call me.
Okay.
They are not supposed to randomly call you and try to solicit business. It's against CMS rules.
Okay.
My suggestion is you just hang up or don't answer calls you don't recognize.
Okay. Yeah, that's good.
Seniors are very open to these scams, and many times on a telephone call, if you say the word yes and are recorded, you could possibly end up with a plan that you didn't really realize that you signed up for. So it's always best to talk with somebody,
Okay.
again, local, who can talk to you face to face.
So anybody that would want to do this would call you, and then you set up an appointment where to meet.
Definitely.
Okay, either at their house or at, like, our center would be okay.
At the center
Dawn
or
Center,
at our
Oxford.
office.
Oh, okay, that's good too.
Right.
So we talked about the prescription drug plans.
Yep.
Under 65, what about people that are under 65?
So many times someone of Medicare age comes in and talks to us, but they may have a spouse who's under 65. So that person might need health care until they reach Medicare age. So we do provide health care under 65, both on and off the marketplace being the federal marketplace,
Okay,
where people can get a subsidy for their health care costs,
okay.
for their plans.
So you can take care of all that for them right there.
Right, and then we also do provide short-term care for people that might have a gap in health care coverage, who need it.
So maybe we'll talk about that short-term and long-term care in our next segment, because that's very important. And usually you don't look at that until you need it, rather than before you need it.
Right.
So that would be a good thing.
Right, and those are separate from Medicare, short
Okay.
and long-term care.
But you still can help people with that, right?
I can definitely provide a name of somebody who does do long-term care.
Okay.
Okay.
Okay, well, this is very interesting, and we're going to take a short break, and we will be right back. Welcome back to Senior Break. Belinda has been talking to us about Medicare Made Easy. And when she's talking about it, it sounds very easy, but there's so many things that go with it, and I'm very, very glad, even for myself, to have you clear up so many things for us. We're going to talk a little bit now about where you can educate people on Medicare if they want to come to a group session.
Right. Our agency provides Medicare Made Easy seminars. For instance, so far in the last month, we have been at Lapeer District Library.
Oh, okay.
We've been at the Senior Center with Oakland Township. We actually had, not Oakland Township, excuse me, Oxford Township, right,
Okay.
right here at
Right here.
Oxford Township Senior Center. We had 27 people come
That's a lot.
for a Medicare seminar. We also will go into senior living communities if we're invited. We provide a 1-hour educational program about Medicare. It's no cost to anyone. It's an educational that we provide for the community because that is our give back. We want people to be educated about Medicare.
And they can ask you questions.
Yes, so
During that.
how we run the seminar is we start off with just the basics. We discuss Medicare Part A and Part B. We talk about Medicare Part D. Then we talk to them about the ways they can take their Medicare, either with a supplement and a standalone drug card or an Advantage plan. We talk about the downfall of just using a plain Medicare card. So we talk about the late enrollment penalties that are out there and educate people so that that does not happen to them. We also talk about low-income subsidy, which is an extra help program through Social Security Administration that a lot of people don't even know about. And it can help our seniors of lower income get discounted, lowered copays for prescriptions. It can sometimes pay for the prescription drug premium. And then if a person is eligible for extra help, they're often referred to the Medicare Savings Program. And sometimes the whole Medicare Part B premium, which seniors are charged, can be partially or fully eliminated.
Wow.
So this year, the Medicare Part B premium is $164.90 a month. It's taken from your Social Security, or you have to pay it quarterly if you're not drawing Social Security. So for a senior of lower income, saving almost $65 a month, that is
a lot
big,
of
big
money.
news.
That's
for
a
them.
month.
A month.
That's a month. The Part D, I just want to go over that
Sure.
one more time. A and B, we understand, but D, can you just give me a brief again about D?
Yes.
If you have D, is that saying that you don't need a supplemental if you have D?
No.
You still have to have D. So D is, I understand A and I understand B. And I know
Okay.
the supplemental will cover the 20%, 80, but
Right.
the D is a little.
Okay. So the supplemental is medical.
Okay. That
Just
I
like
understand.
the original Medicare card is
Okay.
medical. The supplement is medical, and then you have to purchase a standalone prescription drug plan with it.
Okay.
That's if you go the supplemental route. If you
Okay.
go the route, remember the Advantage plan,
Mm-hmm.
then it includes your D for drugs
Okay.
in with
Oh,
the medical.
Okay. Okay.
So it's medical and prescription drug all in
Altogether.
one plan.
Okay, and that was what you would go over, whether that would be best for you or something else. That's a lot to know. That's a lot to have somebody review for us too, because it's important.
Right.
You know, we could be on the wrong plan. You know, we could. I know for myself when I think it was Sandy that came out to talk to me about it. My husband and I only take 2 prescriptions.
Right.
We were paying for a plan that covered so many prescriptions that it helped us. Because she said, you're on the wrong plan, and we switched, so we saved money.
Oh, good.
You know, so it
That's
was
great.
really, really nice, really nice. So we talked about that. Do you want to tell us what to be careful about?
Yes, again, I just want to reiterate that seniors need to be very careful. You need to guard your Medicare card number, your Social Security number. Never give that out over a telephone call or to someone you don't know. Never do that. If somebody calls you and they say they're from Medicare, hang up, because Medicare will never call you. They will only send you a letter in the mail.
Okay.
Okay? So if they say they're from Medicare, that's a scam.
And that's happening a lot this week.
Oh, yes. A lot of times you'll get a phone call and a person will say, well, I can get you a food card with X amount of dollars, right? Can I have your zip code? Hang up, because that is usually a scam just to get you in and talk to you about Medicare. Okay? And then what else can I tell you? Try to use someone local. It's just overwhelming for the senior community because it's all over the television. Seniors get mailings from people they don't know. Sometimes the mailings look very official, like they're coming from the government, right?
Yes.
Have you ever received those?
Yes, and the calls, a lot of calls.
Right, and you think it's somebody from the government agency, but if you look at the very, very small print with a magnifying glass,
They're trying
it
to
will
fool
tell
us.
you that it's not the Medicare agency or the Social Security agency.
And you talked about the payments. Now, the payments for people that aren't on it yet automatically come out.
If you're collecting Social Security at the time you get your Medicare, they will automatically deduct the premium for Medicare Part B from your Social Security.
Okay.
If you're a person who's decided to continue to work beyond age 65, but you're still taking Medicare, you will be billed quarterly for your Medicare Part B premiums.
So this is going to be kind of a different question. If you are under 65 and your husband is deceased, and is there any kind of Medicare you can still be on because he might have been on it? Because he was on it.
No,
Yes.
you would have to wait until you are eligible either by age or disability or end-stage renal failure
Okay.
or Lou Gehrig's disease.
Okay.
Those are the ways that you can get your Medicare, the only ways.
So unless you're married to somebody that's on Medicare, and they'd be on Medicare, they could get another insurance kind of, no, they can't. Okay. Okay, just trying to keep it straight. Okay, so you must be 65.
65,
65,
or
or the other
again, have a
reasons.
disability
Yeah,
that qualifies you for Medicare.
I'm trying to get all the questions in, you know, that I'm thinking that someone might be asking, but this has been really good. This is really so much information that we
is.
really need you. We really need you. And it's so nice that you guys are willing to come out to the house, or you're willing to come to the center, or you're willing to, because in Addison, Sandy, I think you came out too, Belinda.
Yep.
Came out to our center, and once the seniors heard us, I think we were talking amongst ourselves. And once they heard us start talking, they started gathering around because they do have so many questions.
Right.
And things change so fast
Right.
that we don't even know, you know, we don't even know what's changing unless you tell us.
Right.
And then it's who do you believe?
Right.
You know, so as long as we have you to be our advocates, that's wonderful. Well, I think we've covered a lot today with the health plan. Do you want
We
anything
sure
else
did.
you want to add about where you're located?
Again,
How to get a hold of you, your phone number?
Yep, my phone number is 248-318-5866, and our office is at 880 West Dryden Road in Metamora, and we can see seniors pretty much anywhere. If you can't drive, if you don't like to leave the house, if you're housebound, we will come to you.
Okay, well, thank
Okay.
you. Well, you can stay a few more minutes. I'm going to just tell them about Addison Township. Our senior center, we are having a pickleball court is being made. It's going to have a walking path around the pickleball court. Volleyball will be added on, and we're going to have a pavilion. So it's really getting big. People will have to come out there and check us out and see what's going on because it's growing. And it's very, very nice. And it's very nice that we have things that you can be active with. That's so important to stay active.
It's awesome. One of the other agents and myself took the pickleball introduction class here at Oxford Township Senior Center this summer. It was a lot of fun.
Yeah, they
Lots of
say
fun.
it's the most popular senior sport. I'm going to say sport.
All right.
Yeah, so we'll find people. Well, thank you for joining us. And we will see you next week.